if you were to provide your outgoing calls, the clarification in relation to then the incoming calls to Mr Ashton's phone would be very clear.
So again, if a request were made, then of course, on our form, and I'll confirm for you right now, of course we would provide and be cooperative in any way we possibly could. In any way we possibly could.
For all the parties who haven't provided them to date?
If requests were made.
Let's bring in my colleague Andrew Clennell now, and I think Peter would have had a lot of Victorians behind her in that initiative in targeting the Premier face-to-face, because this latest language about saying, look, they might not be able to reopen and so on, honestly, it's getting to a point, Andrew, where there's no consideration, it seems, of the other side of this health equation, most notably the mental health equation.
Well, even outside the budget and the economics and everything else, this is the biggest issue facing Australia right now. What will happen in Victoria, Kieran? And on Friday, from a political point of view, you had two pressure points for Daniel Andrews. That was Peter Credlin's inquisition of him and Jenny Mikakos, the former Health Minister's statement, really sort of querying his version of events. So I think federal Labor has real concerns, if there were an election late next year, as I expect, around losing Victorian seats, because it's the first time people have had a chance to have their say on Daniel Andrews' handling of it, and people's patience, as you can expect in Melbourne, is really wearing thin. You see those numbers again today, 12 again today, 14 yesterday. It's stubborn, Kieran. It's not moving. And how long can you lock down for? Now, people say to me, well, you can't have a third wave. That's probably true. But what if it's just in the community and that's it? What if that's it? That's the real fear here, I think.
Yeah, absolutely. And that other side of the equation, I think, has to be considered more and more. We see the chief health officers, but they're not chief COVID officers. They're chief health officers. And in that context, you've got to look at more than just COVID-19. There's got to be a consideration of the mental health impacts, the social impacts. It's massive right now.
And if the national policy suppression, you just might have to wear continuing low numbers of cases and open very gradually, just to, as you say, assist people's mental health. From what I'm hearing, it's really hurting people down there, this constant vigilance in terms of police stopping you and seeing if you've gone 5Ks. Well, why can't you just go for a drive for 15Ks, go and have a look at the sea or something and drive home? I mean, that's not going to give anyone coronavirus. There are things you can do to improve, as you say, the mental health situation without spreading the coronavirus, and the Victorian government needs to look at that.